Hello and welcome to this DVD about palliative care. You may have been referred to palliative care after being treated for cancer or another life-limiting disease. Perhaps you've been receiving chemotherapy or radiotherapy. This may have been a difficult journey for you. Now you've entered a new chapter in your treatment, palliative care. To palliate means to alleviate or relieve. So the care you'll be receiving from this point on is designed to minimise discomfort and maintain your quality of life during your remaining time. You've taken a brave step by choosing to watch this DVD. Death is one of the least talked about topics in our society, and just thinking about it can bring about feelings of fear or distress. But this DVD aims to bring comfort by providing you with information and guidance. You will hear from health professionals with many years of experience in the field of palliative care. Let's get started.
Now, Mrs. Simpson, you know that last time you were here, we discussed the fact that there was every possibility that your new treatment would not have any impact on the cancer. That seems to be the case. So basically what that means is we've exhausted every avenue, all the different treatments and medicines that we had available to us.
So there's nothing more you can do?
We've done everything we possibly could.
Is there any time frame you can help us with?
Well, obviously it's impossible for me to predict something like that, but based on other patients similar in age to yourself and with a similar type of cancer, it could be 3 months, it could be much longer, it could be less. But what I can do for you now is I'm going to refer you over to palliative care. In future, you'll be looked after by a team from palliative care. Now, what they'll do is they will see to it that the remaining time you have left is as comfortable as possible.
Thank you, Doctor.
Thank you, Doctor.
Palliative care begins when a medical practitioner, often an oncologist, makes a diagnosis that your illness cannot be cured.
It's always difficult giving a patient and their family the diagnosis of an incurable illness. They're often shocked, there's a lot of questions, they're often confrontational. We try very hard to make them understand what it all means, that we can give them still some good quality care and there are treatment options, but our aim is at palliation.
Patients react in various ways to their diagnosis that can include shock, disbelief, fear, sadness, anger. They're asking themselves, why me? And this can result in confusion and a real sense of hopelessness and depression. Other patients may feel a sense of relief because for some time they've been in a state of limbo, and now at least they have a sense of what's happening to them.
It is very important that patients and their families ask questions. It is important for them to understand what is happening to their body. Most people want to know how long have they got to live. This is called the prognosis. We can give people rough estimates, but we can never be exact. It's not an exact science. There are many variables that go together looking at how long a patient has to live. We can ensure that we can give patients good treatment, but we can't always give them a time, and that leads to a lot of uncertainty.
Once you enter into palliative care, your treatment takes on a different focus. Instead of trying to find a cure for your illness, your medical and other health professionals will focus on three main areas. relieving your distressing symptoms, improving the quality and possibly duration of your life, and giving you control of your treatment, allowing you to die in the way you want, in the setting of your choice where possible.
I think it's important that patients and their families realise that palliative care is not just about end of life, it's about quality of life.
Palliative care has evolved over probably about 20 years now. I think people now are surprised to learn that real palliative management includes a holistic and integrated approach that looks after the whole person, and that means not just their physical symptoms like pain and nausea, but also their spiritual, psychosocial, even financial needs. This integrated and holistic approach helps us to better care for the person in their environment with their GP, and means that we often use a multidisciplinary team approach, and will include people such as their cancer specialist or their oncologist, a radiation oncologist, their surgeon who may have been involved in the original breast cancer treatment, or their lung specialist, for example, with their cancer.
All right, how are you?
Yeah, good.
Are you?
Good, keeping well, thank you.
Good to hear.
Yeah, so tell me, what's been happening with you?
Oh, well, I've just been a bit tired lately, just pains
Yeah,
in the stomach area.
yeah.
Yeah.
Abdominals?
Yeah.
Sure.
Sometimes it's really sharp and just like it's, I don't know about that medication prescribed, like OxyContin. I've been taking it, but look, I've got another script for it and everything, but
Okay.
I just don't know whether it's sort of working.
What we might do is move you to morphine. How's that? Okay. I think now it might be a good idea to do a bit of examination. Now we'll just check your lungs out first. Okay. Good. And again. Alright, darling, how about we get you to lie down now?
Okay.
So let's find where the pain's at. Alright, darling.
Just, yeah.
I'll get you to sit up again, slowly. Darling, how's your family doing with all of this?
Well, Tony's really good. He's actually cooking.
Oh, good.
He cooked spaghetti last night. I
Spaghetti
couldn't believe
bolognese,
it.
huh?
And I didn't tell him anything how to cook it. He just, I don't know how he found it, you know, he just cooked it.
That's excellent.
Yeah.
I remember
it's
him
his favourite.
saying it was his favourite.
Palliative care is typically provided by a team of health professionals working together. Treatment is usually coordinated by your GP. However, you may also be referred to a specialist palliative care physician. You may see nurses, social workers and other allied health professionals such as speech therapists and dietitians. And counsellors, pastoral care workers and other carers such as family, friends, volunteers or respite carers may also play a major role in providing palliative care.
My role as a GP in the palliative care process is to coordinate a patient's care. I'm the point of first contact. I organise their medications, their treatments, deal with their general health concerns and refer them to palliative care nursing services. And if specialist involvement's needed, I organise that referral as well.
As a palliative physician or specialist, we're asked to help out by the patient's GP or another specialist when there may be difficult problems, and these problems are specifically related sometimes to pain, difficult to control pain, and save perhaps nausea and vomiting. We're also often asked to help out when it's closer to the end of life and difficult decisions need to be made. We call this end-of-life decision making, and our special expertise is with communications with family and their patients at this time.
As a social worker, I help people with their emotional and social issues. I meet with them and sometimes with their families because the patient's emotional well-being is very connected to their support network.
I'm a nurse and I have fairly regular contact with patients. Part of my role is to help patients to manage their symptoms or to look after aspects of their personal care. If I'm having a problem with managing medications or symptoms, then I will flag that with the GP or get in contact with the palliative care pain specialist.
Oh, they're pretty, aren't they?
Oh, they're beautiful. You know, I just love colour and fragrance. That's what roses are. So.
How are your flowers going?
Oh, they're really coming on. Yeah, like you've got yellow and pink and a lovely apricot colour now of roses. Yeah, they are lovely.
That's nice.
What about you?
Yeah, I just started growing some roses actually. Yeah, you get the kids out there, they're helping me. They're going great.
How's Timothy now? How old
is he?
3. 3?
Yeah.
To bring in some photos, I'd love to see them.
Yeah, I will. I'll bring some next time I come over, I promise.
Okay.
So, how's the nausea? Are you feeling?
Yeah, I was sick last night, but this morning it's been good. Like I haven't even felt nauseous this morning. So
that's good.
Really good, yeah.
How about the pain management? Is that going okay?
Actually, that's really quite good. I'm not feeling like the pain that I was having in the stomach and everything. I'm not feeling.
Oh, that's good.
So.
And what about, are you eating?
I'm not. I just have totally lost my appetite. I'm not eating much.
Yes.
Just maybe nothing. Had some soup last night.
Oh, well, that's good. Okay, we'll try and keep. Like you at least trying to eat something.
Yeah, but I'm not eating steak.
No.
You can receive palliative care in a number of environments. Generally speaking, palliative care is available to you at home, in a hospital, in a hospice or an aged care facility. You may move from one environment to another and back again as your needs change during the course of your treatment. So, how will you make the decision about where to receive palliative care? Well, you may have your own preference based on personal or cultural considerations. Your medical needs may also dictate to some extent where you can base yourself. Depending on your condition, you may need to stay close to full-time medical assistance. Or, like many people, you may find great comfort in being able to stay in the familiar surroundings of your own home. Here, the availability of family or other home carers will be a major factor, along with the cost of medications, equipment hire and other consumables. In any case, don't be shy to inquire about the costs up front when choosing a palliative care service provider.
Many people choose to stay at home up until their death, and I guess medically there's no reason why this isn't possible. There are many home visiting community palliative care services that provide home visiting doctors and nurses to patients' homes. I guess the thing to take into account is that it's a fairly significant role, and it takes commitment from family and loved ones in order to maintain that patient at home.
For some of our patients, hospital care is the only option they have. They may have had their diagnosis made in a hospital and their illness is so short that their only realistic option is to stay in hospital for their care. For some other people who have been looked after in their own home by their family and their community providers, they may develop particular symptoms that are difficult to control and manage safely in the community, and they need to come into hospital or hospice to have those managed adequately and then are able to go home again. And for others, it may be the circumstances where, as their illness progresses, they are unable to be managed safely and appropriately in home and need then to be transferred into hospital or hospice for their end-of-life care.
Getting your worldly affairs in order can contribute to peace of mind for you and your family. You'll want to make sure that your will is up to date and nominate a power of attorney. You might also want to complete an advance health directive, sometimes called a living will, which might include a not for resuscitation order. And your funeral expenses will need to be considered at some point. It may seem too difficult to deal with these issues right now, or it might just feel too early to think about them. But you will be thinking about them on some level, perhaps even subconsciously. You might also want to make sure that your affairs and your family are taken care of and not left with any loose ends. Addressing these practical and legal considerations while you're still clear-headed and able will put everyone's minds at rest.
A will is a legal document that determines who receives your property after you die. It's an important document. If you don't have one, you should. It's one way in which you can make life easier for your loved ones after you've gone. A properly drafted will makes your wishes clear, which can reduce costs, but also make sure the people you care about receive your property as quickly as possible. Another legal document is an enduring power of attorney. Now, this is a document that lets you appoint someone to make decisions for you when you no longer have the ability to make those decisions for yourself. If you do appoint someone to make these decisions under an enduring power of attorney, it's important you talk to them about the sorts of decisions you would like them to make on your behalf when that time comes. You might also want to fill out an advance health directive. This is a legal document that allows you to give directions about how your medical treatment will be handled when you no longer have capacity to make those decisions yourself. You might want to accept some treatment, or there might be treatment like resuscitation that you want to refuse. If you do make one of these documents, it's important that you tell people who will need to know when the time comes: family, friends, doctors.
During the terminal phase of Rhonda's illness, we had a discussion on what her wishes were with the funeral and the burial and so on. She wanted to be cremated, which was a big help knowing that in advance. I also had recommended to me a very good funeral parlour, and they were a great help in organising all the logistics that are required after the death, which I couldn't have done by myself.
In addition to these practical and legal considerations, many people find that attending to spiritual and emotional matters can make a great difference to their state of mind and contribute positively to their palliative care. Take some time to ponder life and death in the context of your faith or worldview. Now might also be the time to put things right with friends and family.
Obviously people have different beliefs and different belief systems, and our role is not to make people conform to any particular set of rules or beliefs, but our role is to companion them and support them on their spiritual journey.
The big questions about life and death come to the fore when you're faced with your imminent death, with the end of your life. Questions about what the process of dying involves, what you believe about death and the possibility of an afterlife, and how you can prepare for that. And so that it can be a very intense time for people.
One important issue is the relationship that people have with their families. What does my family mean to me at a time like this, and how can we support each other?
I've been helped through the grieving process by the knowledge that Rhonda and I experienced a very deep personal commitment to each other through her journey. I am also helped by the fact that I feel that I did everything possible to make that journey easier for her and provide every comfort possible that I could.
Look at that. Beautiful, isn't that just... Remember, we never ever got there. We planned to go.
No, I know. We went hitching. I can't believe that we hitched through Europe.
I know.
Oh, no, Tommy. We've got Tommy in the photo. He was hot for you.
Was it?
He followed us. He followed us to Spain.
The fun we've had together, though.
Yeah, I know.
How are you? How are you really, Christine?
Yeah. Well, I have my ups and downs, you know, good and bad days, but I'm really learning to take a day at a time, and just appreciating the little things.
And anything I can do? Is it anything with Tony or the kids, Sam and Lee?
No, Tony's been excellent, and you know, we've got things under control, but I just appreciate you being here, and thank you for everything. You know, you've always been there for me, like through our long history. You know, we go back a long way.
Yeah, we do.
And you are you're my best mate.
Well, we've been there for each other. It's a two-way street.
I just want to say thank you, thank you. Thank you for everything you've done. You're my mate.
Saying goodbye to those we love can be a challenging task for many palliative patients. Your friends or family may view your diagnosis as an elephant in the room, a silent truth that no one wants to acknowledge. Talking honestly with your loved ones about the way that you feel and expressing your fears or concerns can be of great benefit. Talking honestly with children is also very important in helping them to understand what's happening. Expressing love and feelings openly and even saying goodbye can be an important step in your journey, as well as the journey of your loved ones who will be left behind after your passing.
Sam! Stop it! Stop it, Sam! Go away! Oh, Joe!
Happy birthday to you! Make a wish, quick! Wish for a boyfriend?
No, shush! Which one?
This is a big one.
This one?
Yeah.
If I run?
Don't shake it. No. It's very expensive.
Who's this from?
No, it is. I spent all.
Is this from you and Mum?
I bought it this time. I bought it, honestly. Hey, Mum, come on. Mum, come on, join in, Mum. It's present time, Mum.
Sam, stop it!
I didn't do anything. I didn't do it. Right in the
Dad, really? I want the 2 cherries. Oh, Dad! Oh, baby,
What is it?
great! What, from the popular $2 thing?
Yeah, don't go in the popular
Dad! It's my
We've got the sequel as well. You got what you wanted.
Saying goodbye is a process that affects both parties. It's tough for everyone, but it's also a very important part of the healing process where they can connect and know that they're all feeling the same love and loss.
We used to tell each other every morning as soon as we wake up that we loved each other, and then we both were determined each day that we'd also make a statement that we were going to kick ass on each day as well.
It's quite natural to be apprehensive about what will happen to you over the next weeks or months, or perhaps you're simply curious. In any case, it may be helpful for you to have an overview of the dying process. You'll go through a natural journey of emotions. You may experience many feelings, including denial, anger, fear, withdrawal, self-reflection, detachment, and acceptance. Throughout this time, it's helpful to have someone to talk to about your feelings. You can turn to friends and family, an experienced social worker or pastoral carer, your GP, or other members of your palliative care team.
People do prepare themselves for death in many ways, and ideally they would have prepared over a long period of time for their death. But we don't tend to do that. We tend to wait until the last moment, until we're faced with an imminent death, to start preparing.
That's when many questions start to emerge, and people find a variety of ways of dealing with those questions. Some people like to talk, some people like to do some writing, some people find prayer and meditation helpful. But our role is to actually guide them through some of the questions, help them to find ways to express themselves on that spiritual journey, to bring hope and peace and meaning and even joy. Many people think that there's going to be no joy on the journey, but I find that for many people they find great joy in addressing some of the spiritual questions.
Your physical health may move around 4 stages: stable, unstable, deteriorating and terminal. You'll spend varying amounts of time in each stage as your condition changes. Upon your passing, a period of bereavement begins for your carers. Support is available through all 5 of these stages.
Patients usually start out in a fairly stable condition, but their condition will often fluctuate throughout the course of their time with us. So they may be stable for a while and then may become unstable and then may go back to being stable again once we've sorted out their symptoms or they've had medications or treatments to stabilise their condition. People, as they are entering the terminal phase of their illness, often become weaker, are less mobile, perhaps bedbound. They interact less with their family and eat less and drink less. And often that phase of the illness only lasts for a couple of days. During that time, it's our role to focus on comfort and symptom management, and to ensure that the patient has a dignified and peaceful death surrounded by their family.
Death is rarely a painful process. These days, physical pain and discomfort are managed in sophisticated and effective ways, often through the use of modern pain-killing medication. These medications not only manage pain, but also nausea, shortness of breath, and other distressing symptoms. Your GP can prescribe most of these. Palliative chemotherapy, radiotherapy, or even surgery may be offered in certain cases to shrink or remove tumours which are causing discomfort. The aim is not to cure, but to assist physical comfort. And a number of complementary therapies, such as massage or visualisation, meditation and relaxation techniques, have also helped alleviate pain for many people.
Patients are often fearful of the pain they may experience in palliative care. They're fearful they may be in pain non-stop for many months. But it's not the case. With morphine and other drugs, we can control and prevent almost all of their symptoms, and the physical discomfort and pain they end up experiencing is far less than they ever anticipated.
That brings us to the end of this DVD. I hope it's been helpful. You're about to embark on a powerful journey with the ultimate destination in sight. But you won't be alone. You have many allies, the strength and support that you'll receive from your carers. the sense of empowerment that comes from making informed decisions about your care, the experience of health professionals who've dedicated their lives to palliative care, and your own sense of inner peace that will shine through as you work your way through this difficult time. Thanks for watching.